Hi, I'm Dr. Andrew Dickens with Healing Pathways Cancer Clinic in Scottsdale, Arizona. We're located in Old Town Scottsdale, and you can find us on the web at healingpathwayscancerclinic.com. What I want to talk about here this morning is mammograms. As my business associate Craig Stelflew calls them, mammo-scams. And I want to address that and why that isn't an appropriate terminology for a mammogram. When I was just reading from The Lancet, a journal which is British. It's one of the top two British journals. There's the British Medical Journal and The Lancet. And according to The Lancet, about 5% of screening mammograms are false positives. So that means that women go in for a mammogram. Out of every 100 women, 5% of them will have a positive. And of those, about 80 to 93% will be false positives. In other words, they have a positive looking like cancer, but is not cancer. So they're false positives. It's a false alarm, if you will. And this causes a lot of stress and undue procedures up to surgery and including surgery. It's very stressful on the woman and her family. There's a tremendous amount of expense to that. In talking about women that get a diagnosis of breast cancer, there is quite a bit of number of those. 10 to 15% of those women will have had a negative mammography, a negative mammogram within the past year. So they have cancer because cancer has been there for 5 to 10 years when it's been found. They had cancer, but the mammogram did not pick it up. So there is quite a bit of alarm about mammograms. The Lancet goes on to saying, since the benefit achieved is marginal, the harm caused is substantial, and the costs incurred are enormous, we suggest that public funding for breast cancer screening in any age group is not justifiable. And again, that's from the British Medical Journal Lancet. So there are other cases where the wrong thing is done. Women that have BRCA1 or BRCA2, BRCA1 or BRCA2, these are women who should not get any type of mammogram because they do not have the gene necessary to repair DNA damage from radiation. And yet these are the women that are told that they should get mammograms every 6 months because they have so much of a greater likelihood of having breast cancer. It's just pretty astounding that with the extra radiation, they're actually recommending more radiation. And speaking about radiation, then it is, if a woman, a premenopausal woman, gets 10 years worth of mammograms, she will receive about 5 rads, which is a measurement for radiation, over that 10-year period. And that is equivalent to being within a mile, about a mile out from either Nagasaki or Hiroshima. And radiation is cumulative. So there's quite a bit of radiation that is incurred by getting mammograms. So why do we have the big push for mammograms? Well, the 5 radiologists, medical doctors who specialize in radiation, 5 presidents of the American Cancer Society have been radiologists. So if that's what you do, that's how you see life. It's kind of like lobbyists coming out of Congress or the people leaving the FDA to become a pharmaceutical lobbyist. It's just not really very appropriate. They're not very neutral. They have a strong bias. So these are just a few of the thoughts of why mammograms are not very beneficial. They actually are very expensive. They actually can cause cancer because of the radiation. And if you'd like more information, I suggest that you contact us, Healing Pathways Cancer Clinic, and our phone number is 480-699-7400. Again, that's 480-699-7400. Thank you.